Hi, everyone, and welcome to Office Hours. I'm your host, Stuart Newsom, and today we're exploring one of the most exciting evolutions happening in healthcare operations, and that is transforming the patient experience with voice-first AI agents. Joining me today is Akash Sethi. He's the founder and CEO of Voxology AI, and many of you will recognize him from his years leading product innovation right here at Infinix. So Akash took his experience and everything that he gained about patient automation, patient access, revenue cycle, and has applied it to one of healthcare's most overlooked pain points, and that is the phone call. So how are you doing today, Akarsh?
I'm doing good. I missed these office hours with you, Stuart.
I
So
know,
wanted
I
to
know.
come.
We're far cry from when we did it live at HIMSS right there on the floor.
One of
That
our
was
finest
exciting.
moments together.
Yes, but maybe we'll do it there again one day. Who knows? Uh, that was fun. That was fun. But yeah, you're always welcome to come back and you can host. I can tell you the first office hours I was exposed to, you were the host, not me. I come from a great teacher on
We
doing
go
that.
back.
Yes, exactly, exactly.
We're
So
gonna have some softball questions here, right?
I'm sorry, what was that?
So we're gonna have some softball questions here.
That's right. Softball questions, exactly. Nothing hard, nothing hard. But no, you can handle it, because this is so innovative. I mean, when I first saw this, my mind was absolutely blown. What we're going to talk about how voice first AI agents are changing the way patients connect with their providers. So things like scheduling to reminders, every touch point that shapes the patient experience, if you will. So um, these conversational agents, as I like to call them, I'm not sure if that's what you call them, Akars, conversational agents. They're built to do more than just answer calls. They actually listen, respond with empathy, if you can imagine that. Help providers deliver faster, more compassionate service around the clock. And now, just a reminder, everyone, as always, we're going to have a Q&A session at the end. So I just want to remind you to drop your questions. You can drop them in there throughout the session we're going to have today. And also, I welcome comments and insights. I do that every time. It's not just Q&A, but if you have something to share that's insightful, please share it as well. All right. So, Akash, you ready to dive in?
Yeah, let's do it.
You got the first softball coming at you. So,
Um,
so you've been around the block, so to speak. You've seen healthcare automation evolve, from the back office to the front office. What made you focus on the phone call as the next major frontier?
Yeah, the front office is such an important part of both the patient journey and revenue cycle, right? I think traditionally people think front office is patient experience, back office is revenue cycle. What we have found and what I strongly believe is the front office and the contact center being such a big part of it. The phone calls is not only where the patient journey begins, but it's also where revenue begins, right? And leveraging my experience in revenue cycle management and taking that and wanting to create a better patient experience is what gravitated me towards the front office and the contact center. You referenced phone calls, and phone calls are a really big part of the front office. 88% of appointments in the country today are still booked through phone. And that's just the consumer behavior preference within this market segment, within the healthcare industry, right? People, when they have something going on with them, they want to call the nearest clinic or the hospital. They want to have that conversation. They want to book an appointment, right? I think healthcare has tried to have these self-service portals. Patients are not going there, right? Patients don't want to maintain logins and log into their Athena portal and their Epic portal and their ECW portal for three different clinics that they go to. They just want to be able to call and have that conversation. So uh, due to those reasons, I think my focus has been the front office and the patient experience for the last year or so. And, you know, that has been one segment of the entire patient journey and revenue cycle that has been severely under-innovated. And the reason for that is precisely because the mode of interaction is voice. So historically, right before the Gen AI disruption and revolution, we just didn't have the technology to help this use case. What we now have is AI and AI agents that have natural language understanding capabilities and can truly interact with humans like humans.
Yeah, that's amazing. And it's still kind of blowing my mind. It's not the press one, press two for whatever department you need to go to, and you go down this, so to speak, this channel or this tunnel. It's almost like you're going down to hell in some of these instances. But
Right.
um, so with that, why do you believe voice first automation is the key to transforming the patient experience? Like as you said earlier, it's convenience. They're still picking up the phone and making that phone call. Um, so how does it differ from the traditional IVRs or chatbot systems that everyone is so accustomed to now? Because you can obviously tell, hey, I'm talking to a robot here.
Yeah, so these traditional chatbots that you see in some of these practice websites, or even I know you reference IVRs, right?
Mhm.
Who likes IVRs? I don't know a single person who said, "Oh, IVRs are great." IVRs are a waste of time, right? Press one, press two, press three, and it's either a waste of time or most people are just trying to press zero and go to an operator. And what
Hmm.
happens there is the operator, you end up speaking to the operator for 30 seconds or a minute, and then the operator just routes your call to someone else, and then you just have to repeat information again.
Right, right. Or you're screaming in the phone, representative, right?
Exactly. Right. So, and then you have the chatbots, right, which are similar in the way that they're not interactive, right? In terms of truly human-like interactions, they're just rigid decision trees, which is they are trying to look for certain keywords and have certain answers based on those keywords. What, the past year of doing this has taught me is patient interactions are not structured and rigid data. It is the most diverse set of unstructured conversations that can take place, right? No one calls in and says, "Hey, I am X. I want to see Dr. Y at time Z." I mean, I would say under 5% of patient conversations are like that. Most of the times it's, hey, some sort of, explanation behind the symptoms they're feeling. They talk about things that are going on in their lives. They talk about complexities with respect to what they want to see versus what they don't want to see. Um, and all of that needs to be incorporated, right? So the contact center, the front office, does two things. It does routing and triage, and it does task completion, right? For anything that's administrative, mainly scheduling related, the front office is set to actually go ahead and complete the entire task end to end. And then typically, if there's something financial or clinical in nature, the front office understands the intent and the questions and then sends it to the right department. So these IVRs and these chatbots do an okay job on the triage and the routing, and they can offer nothing on actual task completion.
Right.
Because, as I mentioned, end-to-end task completion for scheduling, rescheduling, cancellations actually requires understanding of context and intent, right? And it requires the patient to want to have a conversation, because then those aren't 20-second conversations. Those can be 4, 5, 6-minute conversations. So
Hmm.
that's where voice AI comes in, right? Voice AI has both style and substance. Okay. First one, in terms of style, you actually feel like you're talking to a human, right? Is it 100% human? Probably not yet. I suspect we'll get there pretty soon, but it's
Hmm.
pretty darn close to being a human-like interaction. Second one is it's the substance, right? Which is it actually has the capabilities to go ahead, look at, where you're calling in from, what are your symptoms, who did you last see, what do you need to be seen for, find the right physician, match you with the right physician, the right location, the right times based on your preference, and book those appointments end to end, just like a human would. These AI agents are intelligent enough to follow the same SOPs that providers have for their front office staff. right? For scheduling patients, new versus existing. Do you want to take in PPOs or HMOs? What kind of plans do you want to see versus not see versus, hey, physician X only sees these kinds of patients in the second half of the day on Tuesdays, versus physician Y can see those patients, but only Thursday mornings, right? These AI agents have that intelligence, capacity, contextual awareness to
Mhm.
actually have the skills to complete these tasks. But in addition, they can do it in a style that's natural, that's empathetic, that actually makes you want to speak to them.
Right, right. Without any human emotion, right?
Right.
Well, maybe
I mean,
there is some emotion there, but it's not
without
the
any
human.
negative human emotion, right?
Right,
Think
right.
about one of the things that these AI agents bring in is reliability and experience, right? How
Mhm.
many times have you, I mean, let me phrase this differently. The number of Google reviews that I've seen from patients, negative Google reviews on clinics, the number of them, vast majority of them are actually criticizing the admin process, criticizing, hey,
Mhm.
I was put on hold, or this one was rude to me. They're never about, hey, doc was bad. Doc is always
Right.
great. Doc is usually great, right? So, a number of times I know I have been at the end of someone rude talking to me, and I'm just like, wait, why is this happening? Right?
Right.
So people have bad days, people are stressed, people are doing a lot. These AI agents will not bring out that negative emotion, right? They're always positive emotion.
Yeah, yeah, that's key. It's almost making it seem real as well. And in talking about those challenges, that probably frustrate the staff. Maybe they're bringing in that baggage, right?
Hmm.
But what challenges do providers, and when I say providers, I mean even the admin staff, face today in managing call volume? Obviously, that's going to escalate the ripple effect to scheduling, ripple effect to staffing. How do AI agents help alleviate that strain?
Yeah. I talk about the three V's. So volume, vacancy, and variability. All right. So where does that baggage come from, right? As you said, well, practices are getting flooded with calls, right? I think inbound calls coming in is one of the top reasons of frustrations for the admin staff, right? They're not able to keep up with them. And especially when the same staff has to take care of patients and answer to patients who are on site, is also having to take calls, and they're constantly putting people on hold while they're talking to patients, or worse yet, putting the patients who are in person at the site on hold while they're taking calls. So these massive volumes and the inability for provider staff to keep up with them is causing long hold times, is causing high abandonment rates. And then it just, again, all of this leads to a negative patient experience. And then from a revenue point of view, just churn for the provider too,
Hmm.
right? And as I mentioned, right, point two was vacancy. Vacancy is essentially alluding to staffing shortages, right? I think across the country, within the healthcare industry, you will see staffing shortages. Providers are trying to scale and grow, but either due to, you know, non-sustainable cost structures or the inability to find talent, they just aren't able to hire and keep hiring
Right.
at the level they need to grow at, right? And again, that creates a vacuum, that creates a gap in terms of being able to serve the patient population. And the last one is variability, right? Which again, just alludes to the complexity of these conversations. These conversations are rarely straightforward and easy. There's a lot of complexity. Talk to, an admin staff who's dealing with a provider practice that has more than 10, 20, 30 physicians. Typically, every physician has their own nuances in terms of the kind of patients they want to see, they don't want to see. And it can just get fairly complicated pretty fast. And,
Mhm.
it just leads to inaccuracies. And that's another point of frustration for both providers and admin staff.
Yeah, exactly. So, and which ties back to the emotion that we talked about earlier. So you kind of
Mhm.
touched on this with my next question, but can you explain how empathy and context, which I've heard you use those words already just in the last 15 minutes, How are those built into these voice agents? So they can actually respond naturally, compassionately, to real patient scenarios, real patients' issues who are suffering.
Yeah, empathy in AI doesn't just come from tone alone. It comes from context and intent understanding. Our AI agents are designed to listen first. They pick up on cues like urgency, emotion, intent, and they know the difference between when a patient says, I'm scared to get my test results versus I need to reschedule, right?
Mhm.
So we've layered intent detection, memory, adaptive phrasing, so that the response feels more human and not scripted, right? For example, AI agent saying, I completely understand. Let's make sure we get you seen as soon as possible, right? Or I'm sorry you're not feeling well. I can help you get connected right away. Instead of just blindly following a script and saying a set of words, right? So this blend of linguistic empathy plus operational precision is what makes our agentic AI really viable in healthcare.
Yeah, that's awesome. So and apparently you definitely have some early adopters out there who are already experiencing this. What are some of the measurable results that they've seen so far? Like reduced hold times, increased appointment rates, or
Mhm.
improved satisfaction.
Yeah, all of the above, right?
Mm.
I think what we can quantify now is providers across the country, whether it's in Texas, California, Georgia, Carolinas, we're seeing a reduction in call volumes, in front office call volumes, right? Because the AI agents are able to perform end-to-end automation of these calls. So it's a reduction in administrative contact center related call volumes anywhere between 40 to 60% of those
Mm.
administrative front office call volumes just being automated, right? So that's a massive advantage for these providers. And then the second one that often gets overlooked is increased patient appointments. You know, these AI agents are available 24/7. They're able to speak multiple languages, right? Not just English, but also Spanish and other languages. And they never put anyone on hold, right? So patient calls in, the phone gets picked up right away. So any provider one that's dealing with long hold times or abandonment rates, that's a huge set of population that now has access to care. That contributes to increased patient appointments. 24/7 availability contributes to increased patient appointments, right? Uh, Access to healthcare shouldn't just be 9 to 5, right? But
Mhm.
scheduling is just 9 to 5 for most providers. These AI agents can schedule patients 24/7. And we see a lot of patients trying to book appointments between 5 p.m. and 7 p.m. and between 6 a.m. and 8 and 9 a.m. in the morning or 8 a.m. in the
Right,
morning. And
right.
then availability on holidays and weekends, all of that contributes to anywhere between a 5 to 10% increase in patient appointments. And if you have high abandonment rates, it's towards the lower end of that. If you have high abandonment rates, it's towards the higher end of that.
Yeah. And that's always a ripple effect to revenue, right? Because
Mhm.
I mean, some people may think, oh, well, it's just a phone call. It's just the phone. It's just the front end. How impactful can that be? But when it starts impacting scheduling, which impacts if you don't have a patient scheduled, it's going to impact, hey, there's a visit, there's a procedure, whatever the case may be, that we could not bill for. So it's definitely going to affect revenue, from that regard. Um, so looking forward, I always like to have one question that I ask each guest about how you see the future. How do you see conversational AI evolving to support other areas of healthcare communication beyond scheduling? Because the phone plays a critical piece to the entire revenue cycle. And it's one of those things that's probably the vein of everybody's existence in some areas, as you know. So how do you see that translating from conversational AI into that realm?
Yeah, we've spoken about scheduling, and there's so much more than scheduling that these AI agents are already doing. they're looking at the entire administrative part of the front office, whether it's checking on referral statuses, checking on prescription refill statuses, taking new prescription refill requests, or other such administrative functions. These AI agents already starting to venture into that space. But as we look forward, as we look towards the other two main areas that the front office focuses on, which is the financial functions and the care coordination functions, I think there's an immense scope for natural voice-based interactions, intelligent interactions to help augment capacity intelligently within those rungs as well. So imagine the AI agent not only can schedule your MRI, but can also verify your insurance, calculate your out-of-pocket estimate, send reminders, let you know on that call itself, hey, your estimated cost for this procedure is going to be this, right? And then on the care coordination front, I think today, when patients leave the door of a clinic, they have essentially no touch point with the provider anymore, right? Well, they'll tell you, yes, we do have a touch point, which is a hidden bill that I get, which is just more payments. But that's not how healthcare should be, right? Healthcare should be providers being with the patient throughout their care journey, even after they've left the door. So imagine these AI agents that can essentially be a personal companion for patients, where they can educate them on their treatment plans. Let's say someone is doing physical therapy, or geriatric patient, is on some sort of treatment plan. These AI agents can tell them exactly, hey, these are all the things you need to do today. Check in with them. It's time to take your medication. Have you taken it? It's time to do your, stretches or the physical therapy routine that you're supposed to be doing. And then monitor adherence and responsiveness, right? Which is, how are you feeling? Are you feeling better? Are you not feeling better? Your pain scale was at
Mm,
an 8 when you left the office. It's been 3 days. Are you still at an 8, right? If you're still at an 8, well, guess what? Maybe I think we need to get you in for a follow-up appointment sooner than before.
right.
So I think that's
Yes.
where we're headed, right? Digital front office that connects the patient, provider, and payer ecosystem seamlessly.
Yeah, you touched on that. That's what you're talking about, chronic care management. I mean, that's huge. I mean, if they could be involved in that, that's tremendous. So there are a lot of different applications. So, and the sky's the limit from what I can see, with utilizing conversational AI. It is something that's not just on the horizon; it's here. And as you're demonstrating and talking about it here. I'm just um, excited about this technology, probably more than any other technology that I've seen just in the last year or so. AI has exploded, and it's just advancing at a rapid rate. After being in this business for 30 years, I tell everyone I've seen a lot of technology change through that time.
Yeah,
Obviously, 30 years, 3 decades is a long time, but nothing as accelerated as what we're going through now. So I can only tell you this is
I
it's
agree.
going to get faster and faster. So everyone needs to either show up and adapt or get left behind. And this is one area where I think it's going to and be impactful for that as well. Um, well, that's all the questions that I have. So now we're going to turn to Q&A for the audience. So I'm just going to look and take a peek and see if there's any questions that we have available from our audience. We do have one here, Akarsh, and it's a good one. Me being a certified compliance officer at heart, I can tell you, how does this technology maintain accuracy and HIPAA compliance when managing sensitive patient information over voice interactions?
Yeah, I think, accuracy and compliance and security are foundational to what we're doing, right? They're not features, they're not good to have, they're foundational to what we're building here. So let's address compliance first, and then we'll talk about accuracy. So all of the solutions, the AI agents that I have been talking about for the last 25 minutes or so, it's all SOC 2 Type 2 compliant, it's HIPAA compliant. Every data flow from transcription to scheduling is encrypted end to end and follows best in class standards, right? As stated by SOC 2 and by HIPAA. So I think, healthcare has been scarred and has some PTSD from some, I think, high level cyber attacks and compliance issues over the past decade and even before that. So, I think one thing we want to make sure is we learn, and by we, I mean healthcare as an industry learns
Mhm.
to not make the same mistakes a couple of times. So we are over-indexed on this and we take it extremely seriously. Accuracy is another very important topic, especially in agentic AI. For those who are familiar with generative AI and agentic AI, might have heard the term hallucinations
Mhm.
being talked about here and there. How do you prevent the AI agent from hallucinating, which is, you know, you say it's probabilistic and it's interactive, it's human-like, as opposed to being just rules-driven and rigid, which is great. But that what that also leads to is sometimes uncertainty and hallucinations, right? Imagine an AI agent saying, hey, Dr. X, who is one of your prominent physicians, doesn't work at this clinic. That's essentially a hallucination, right? Now, there are a lot of ways and a lot of efforts that can be taken to prevent hallucinations and to create safeguards around them, right? So I think that's top of mind for us as well, in terms of we always bias towards accuracy over coverage, right? Which is when in doubt, always manual handoff, right? That's the philosophy that we take, which is when the AI agent doesn't have a high degree of confidence in something, it's always better to just hand off to the human as opposed to try and take on something that is more complicated and challenging, but the AI doesn't have a high degree of complexity. So that has been our approach, and that is something that, again, we invest a lot of time and effort into ensuring.
Yeah, because when it comes to patient information, that is the best approach. Is that tech-enabled augmentation, collaboration, like we like to call around here. As you well know, we call it orchestration between
Yep.
the AI agent and the human specialist, and together they actually get the job done. So that's amazing. Um, One last question from the audience. I'm just checking again if there's any more coming in. But what does implementation look like for a provider who wants to adopt voice first automation? How long before they see tangible results?
I think the great thing about this technology is because it is right there and interacting with patients, the ROI is realized starting day one, right? This isn't a VBC type software that you don't know what the ROI and the benefits are. You realize them 6 months or 12 months out. You start seeing them on day one, right? So implementation is designed to reduce attrition and change management. I think those who are familiar with Infinix and our work here, I think understand that, we pride ourselves, and now at Voxology, we pride ourselves at integrations as well. So typical onboarding timelines are 4 to 6 weeks. They consist of three phases. The phase one is discovery, which is where, we sit down with you and document and understand all your existing SOPs around scheduling and your scripts that you give your front office. We take all of those into account and create a set of SOPs for the AI agent, which we share with the provider, and the provider signs off on it. Phase two is configuration, setup, and integrations, right? So depending on whatever EMR you are on, whether it's, specialty specific EMR, whether it's a national EMR, uh, the Infinix team will essentially integrate with that EMR, configure and set up your AI agents with all the rules set in the knowledge base that was provided in the SOPs. That takes an additional week. And then at the end of 3 weeks, what we do is we give you a number, which is essentially a proxy for your practice number. It's connected to your EMR. It has all the rules set. It's essentially your practice's AI agent phone number, which you can call. and start user acceptance testing, which is 2 weeks of challenge the AI with every scenario. We sit down with you and map out high frequency scenarios, edge cases. You can test it end to end, watch appointments get booked in your EMR, watch appointments get rescheduled, cancellations, tasks get created, whatever it is that we are doing with you. And then at the end of the day, we essentially shift that number onto your designated phone number that you have, that clinics, that patients call you on, and we start go live. And we always do go live in a phased approach, which is we start with after hours, which is again lower volumes. We sit down, we show you the data, we make you hear the conversations. And after about a week, we take it into business hours, typically second half of the day. And same thing again, close touch points with the provider, showing data, making you listen to conversations, and collecting feedback, if any. And then at the end of the second week of go live, we essentially tend to go 24/7.
And that's not a very long time, really. I mean, it's pretty quick. It's pretty fast, is what I'm alluding to there. So, and that's amazing in itself. And I'm sure
Not
it'll.
at all. And I think in terms of the ROI that you asked, right? From the
Mhm.
day one that these AI agents go live, you will have data available to you in terms of how many calls were answered, how many calls were completed, how many calls were triaged. So that is your value right there. It's not
Mhm.
complicated. You see it right then and there.
That's awesome. It's very transparent and it's immediate, instant
Yep.
gratification, right? It's awesome.
Browser
All
like
right.
it.
Well, I don't see any additional questions. So we'll wrap things up. Akash, thank you for joining us and sharing your insights on how voice first AI agents are reshaping the patient experience. It's always great to catch up with you. Really missed having you around, man. And so it's really great to have you on today. So thank you for sharing with us.
Of course. Thank you for having me. So
Yeah,
hopefully we can do this
absolutely.
again.
And to everyone else listening, thank you for being here. Be sure to check us out. There is a press release as well. There's more information, on our website as well. You can always look for this on demand with some other office hours episodes out there. And don't forget our podcast. We do have a podcast called Revenue Cycle Optimize that has insights just like you're hearing today that can be very insightful for you. So with that, we'll see you in our next office hours.